No, in America recently, the obesity, especially children's obesity, is into news. So how much that contributes to the heart situation?
Right. Again, obesity is a very important issue, especially in our community nowadays. We see a lot of children who are obese. They have taken out this term obese nowadays by American Academy of Pediatrics. They say it's kind of derogatory. So instead of obese, they say overweight children now.
Overweight children.
So that way it doesn't kind of put the psychological stress on the children.
Right.
But having said that, obesity is a very big problem in our society now. So if you're obese, obviously your risk factors increase. Like I said, there are different stages where atherosclerosis develops, which is thickening of your arteries. So these are some of the different stages of atherosclerosis. This is normal, then you see, I think I'm holding it the wrong way. Yeah. So this is the normal vessel, and here you see fatty streaks. Here you see there is deposition of fat, and there is also deposition, there is thrombus formation here, and then there's occlusion. So these are the different stages. So in obesity, somebody who has high cholesterol level in childhood, they develop fatty streaks. Fatty streaks are few fat cells deposited within the arteries, which are, like you can see in this picture I have here, these are some of the fatty streaks. They're not uniformly distributed within the arteries, but they're just discrete deposition. So when you have deposition of fatty streaks within the artery, that's a reversible process. So if you catch in that stage, then you can reverse the process of atherosclerosis. That's a very good question again. There are different ways of dealing with this issue. There are different types of cholesterol. We have LDL, which is called the bad cholesterol, as we commonly talk about. It's actually the LDL cholesterol. The good cholesterol is the high density lipoprotein, which is HDL. So when we refer to cholesterol, high cholesterol level, it refers to the LDL part of the cholesterol. So initially, normally what happens is we do a blood test. That's the first thing we do when we are suspecting somebody to have high cholesterol level. So ideally it should be done in a fasting stage, but obviously when a child is coming to your office, he doesn't expect you to do this test, so they're all, they have their meals and they're
that is doctor's point of view.
Exactly. So in those situations, we draw the blood. With that sample, you can very accurately get your total cholesterol level, you can get your HDL level. But the LDL level is not reliable when you have taken your meals and when you're not fasting. So you can derive the non-HDL part of it by subtracting the total cholesterol from the good cholesterol level. So once you have diagnosed, normally the total cholesterol level should be less than 200. So if it is more than that, that is considered as high cholesterol level. If you have your LDL level more than 130, that is considered as high cholesterol, high LDL levels. So if somebody has high cholesterol, total cholesterol, high LDL, and normally you should have more than 40 of your good cholesterol. So if that is less, then they are high risk group. We also take into consideration the family history. It's very vital when you're screening these children. If you have one of the parents who had heart attacks, who had strokes, who had high cholesterol level themselves, less than 55 years of age, or somebody died suddenly less than 55 years of age, we categorize them under high risk category. So once you take the family history, you have your cholesterol levels in the child, then you decide whether he falls into a high risk category, moderate risk category, or mild risk category. So if it is moderate to high risk category, again depending on these factors which I just told you, we initially start them on what we call as therapeutic lifestyle changing diet. In that, basically what you're trying to do is you're trying to alter the diet for the child, which involves a little bit of lifestyle changes also. Initially by American Academy of Pediatrics it was called step 1 and step 2 diet, but now that has changed to therapeutic lifestyle changing diets. So in this diet what we initially do is we tell them that the total cholesterol should be 25 to 35% of your total calorie intake. So in that category, we again categorize them into saturated fats, polyunsaturated or monosaturated fat. The saturated fat should be less than 7%. Yeah. And the carbohydrates should constitute about 55 to 65% of your total calorie intake, and about 15% should come from your proteins.
Dr. Quraishi, this is a very interesting subject and a very important subject. We can talk about it later on also.
Sure.
But at the end, why don't you just tell the viewers, I mean, your Academy of Pediatricians or cardiologist combined together, and what is your advice to the parents of the children?
Sure.
In just a minute or so.
Sure, no problem. The most important thing to keep in mind is atherosclerosis can develop in childhood. It has to be taken care of during childhood period itself, and you should be careful in the diet, and the most important thing is you should get evaluated yourself, and if you have high risk, like I just told you, those categories, then you should screen your children also. And the most important thing is, if your output, if you're not burning enough energy, then you tend to accumulate more of that. So video games, watching television.
Go out and exercise.
Exactly. So those things can be detrimental.
Right.
So the best thing is right diet, lots of fruits, vegetables, fresh juices, the sodas, and not doing much exercise, letting our children play with video games. These can be detrimental. So that's the most important thing I would.
Dr. Quraishi, thank you for coming here and giving us this informative talk, because as I said in the beginning of the show that we don't associate heart diseases with children, young children especially. I mean, there's some children are born, that's a different issue, but to develop heart problems in young children, we don't, and that's very important thing that we should as a parent watch out for the children, and this is something which can happen, not that much, but it can happen. Thank you once again.
Thank you very much.
Our guest today was Dr. Shahed Quraishi, who is Director of Pediatric Cardiology at Wyckoff Hospital. Program will continue right after this break.